Welcome to this webinar which will take you through the Grampians Medicare Locals Quality Improvement COPD Collaborative which we are involved in 2014. You're listening to this webinar because you are a member of one of the teams who are involved. We have 4 general practices involved in this project and we also have 4 pharmacies, so thank you very much for making the time to watch this webinar. What I'd like to cover today is some background about the project and also to introduce the actual model for improvement, which provides the quality framework. So Grampians Medicare Locals Regions Respiratory Health. We have some significant issues which you may not be aware of. Currently we are ranked 1 out of the 61 Medicare locals for the proportion of people with a respiratory system disease, and we are also ranked at number 8 for the number of people with chronic obstructive pulmonary disease, or COPD. We also have the highest number of adults who smoke on a daily basis. This is at 28%. The national average sits at about 17%, and the lowest percentage is in Sydney at 6%. So as you can see, we are significantly above all of those. Our response to these respiratory issues in our region are the following. We have partnered with Boehringer Ingelheim and the Australian Primary Care Collaborative to pull the 2 projects together to form our COPD Collaborative Quality Improvement Project. We know that the earlier diagnosis and management of COPD has the potential to reduce the burden of COPD from both an individual and a health resource perspective. So our goal for this project is to increase the identification and diagnosis of patients with COPD by 10% in a 6-month period commencing April 2014. Now we're already into May, as you'd be aware, and we have collected the baseline data from both general practice and pharmacy in regards to the specific measures that you are collecting. This is the team, and hopefully you've met some or all of us. I'm Linda Govan. We have Claire Sladden, who is in Ararat, Mandy Jones in Horsham, and Tanya Gradoff, based in Ballarat. So now I'd like to introduce you to the model for improvement. And the learning outcomes from this session are the following. That you should have an increased understanding of the importance of quality, that you gain an understanding of the model for improvement tool and how it can be applied, and you should be able to test an idea using the model for improvement and complete a PDSA cycle. We also ask that you share the learnings from today with other staff at your organisation. So what is quality? Well, quality of a product or a service refers to the perception of the degree to which the product or service meets the customer's expectations. It has no specific meaning unless it is related to a specific function or an object, and it's a perceptual, conditional and somewhat subjective attribute. And what is continuous quality improvement? Well, this involves systems and techniques for the constant review, evaluation and improvement of work processes in terms of efficiency, effectiveness and flexibility. And for general practice, you would be very aware of the RACGP standards, which provide the quality framework within which general practice operates. So what is the tool? Well, the tool for managing change was first published in 1992, and the model for improvement is really all about helping you to break down your change effort. I would recommend that after this presentation you go and watch this YouTube clip about the model for improvement. It's a very succinct example of the model for improvement in practice. So what are the 3 fundamental questions? Well, the model for improvement covers these areas. The first question is, what are we trying to accomplish? By answering this question, you will develop your goal. How will you know that a change is an improvement? By answering this question, you will develop measures for tracking your goal. And this is an imperative part of the project. You need to be able to measure to see if there is an improvement. What changes can we make that will result in an improvement? By answering this question, you will develop ideas for change. So you have the goal, you have your measures, and you have the ideas for change. These form the three fundamental questions for the model for improvement. When you're up to your change ideas, you then need to test these using the Plan, Do, Study, Act process. Now, how to test? Well, you need to plan multiple cycles to test ideas, and you need to start on a really small scale. For example, you might want to start with one patient or one clinician at one afternoon clinic and increase the numbers as you refine the ideas. And you need to test the proposed change with people who believe in the improvement. Don't try to convert people into accepting the change in the early stages. And only implement the idea when you're confident you have considered and tested all the possible ways of achieving that change. So identifying possible PDSAs. Well, as we know, success is all in the preparation. As human beings, we are all too ready to jump to solutions. But again, in this process, using the model for improvement, it is really breaking down the steps into small, manageable chunks. So possible tools for identifying PDSAs can be any one of these quality activities, and I won't go through them all within the webinar. Certainly brainstorming is a very effective technique. It's a very good way of involving your team in coming up with how you might tackle some of the change ideas. And also process mapping is also an effective quality tool. So for this project, the goal, as mentioned earlier, is to increase the identification of patients with COPD by 10% in the next 6 months. And this project wraps up at the end of October in regards to the measuring. Now the measures have already been put into place, and for general practice there are a suite of COPD measures, and these are extracted from your clinical software using the PenCat tool and are sent to the Improvement Foundation's portal, where they will be graphed, and you have access to the portal, and you might just need to find your paperwork, but you are able to log into the Improvement Foundation portal and watch the measures over the next months, and hopefully you will see improvement as we go forward. For pharmacy, the measures will be collected manually, and we have discussed these with each of the pharmacies involved. The two measures are the number of patients who were screened using the PICO-6. The second measure is the number of patients who are screened using the PICO-6 who are identified as at high risk of COPD and who are referred to their general practitioner. Again, all of these measures will be available to be viewed on the portal only for your own health service. You won't be able to see everybody else's measures, but it will be beneficial for you to share with your team as you progress in this project. The third part of the third fundamental question is, what are your ideas for change? So as you can see, we've got the goal, the measures. Now, what are some of the ideas for change? Well, because the Improvement Foundation has previously run projects focusing on COPD, they have already provided some structure around potential ideas. So these are just a guide as to what you may choose to do within your practice or your pharmacy. You may want to agree on a clear definition of COPD in your general practice, and you may wish to develop a COPD register, as you may already have a register for your patients with diabetes. You might decide to maintain an accurate record of smoking status in all of your patients. You may decide to identify patients with undiagnosed COPD, and this is something that can be done very simply using one of the PenCat recipes, and the Grampians Medicare local team who are involved in this project can help you with that process. You may decide to develop systems to maintain a valid register, and again this will see you work, if you're the general practitioner, this will see you working with your practice nurse in moving that forward. And the final idea here is to deliver diagnostic screening or testing. This one is specifically for pharmacies, as we know that you are looking at using the PICO-6 to identify patients with COPD. but for you it's about how you implement that process, and that is where using the PDSA cycle or cycles will come into play and help you test those ideas on a small scale before you implement a whole program. So what are the issues and challenges when using the model for improvement? What we know is that testing of ideas doesn't come naturally. People have a tendency to try and solve a problem with just one PDSA cycle, or they may decide to implement changes without the planning, or perhaps not reflect on what you've done, and that comes into the study part of the Plan, Do, Study, Act process. And the final issue is not documenting your PDSA cycles. It is important to do that because you can see where you've come from and where you're heading to. And again, accessing the Improvement Foundation portal will allow you to actually upload your PDSA cycles so that you and your team can review those as you progress through the project. So also it's very important that you involve your team in this process. We encourage you to introduce the model for improvement to other staff, and again we at Medicare Local are very happy to come and talk to your team about the model and to do some practice PDSAs if that would help. It's also important to ask the team for their ideas on improvement. It's important to use protected time to undertake improvement work. It's very easy to get caught up in the busyness of the workplace, and that's very understandable, but if you can set aside an allocated or protected amount of time per week just to focus on the project, you will make more progress with it. Perhaps you could put the model for improvement on your next meeting agenda, ask for ideas on your notice board, and also as the project progresses, share the good work, share the successes, because there is nothing more motivating within a team than to see that you are actually getting some wins. So your next step is to develop your first PDSA if you haven't already done one. What action will you do to progress your idea? What did you do? What were the results of the action you took? And is there any follow-up activity required? As you can see, it really puts everything into a very neat structure. So finally, if you could complete the evaluation of the webinar, that would be great. Have a team meeting at your workplace about the project and start working on your first PDSA if you haven't already. Thank you for listening to the webinar. I hope it has been helpful. Remember that each member of the Grampians Medicare Local project team are available to support you over the next 6 months, and we look forward to seeing some success as the project progresses. Thank you very much.